children. Inflammation of the lung parenchyma characterized by consolidation of the affected part, the alveolar spaces being filled with exudates, inflammatory cells, and fibrin. Most cases are due to infection by bacteria or viruses, a few to inhalation of chemicals or trauma to the chest wall, and a small minority to rickettsia, fungi, and yeasts. Causes of pneumonia in children. In newborn infants, the most feared etiologic agent of pneumonia is Group B Streptococcus, GBS. The bacterial causes are Streptococcus pneumoniae, Group A Streptococci, Haemophilus influenza and Staphylococcus aureus. Beyond the newborn period, viruses cause most lower respiratory tract infections in infants. The most common agents are the parainfluenza viruses, influenza virus, adenovirus, and respiratory syncytial virus, RSV. Atypical organisms also cause infections in infants. Of these, Chlamydia trachomatis, Ureaplasma ureolyticum, cytomegalovirus, and Pneumocystis carinii, PCP, are the most common. Epidemiology of pneumonia. Incidence: WHO estimates there are 150.7 million cases of pneumonia each year in children younger than 5 years, with as many as 20 million cases severe enough to require hospital admission. Mortality: the mortality rate in developed countries is low, 1 per 1,000 per year. In developing countries, respiratory tract infections are not only more prevalent but more severe, accounting for more than 4 million deaths annually. Pneumonia is the #1 killer of children in these societies. Seasonality: although both viral and bacterial pneumonia occur throughout the year, they are more prevalent during the colder months, presumably because direct transmission of infected droplets is enhanced by indoor crowding. Lower socioeconomic groups have a higher prevalence of pneumonia, which correlates best with family size, a reflection of environmental crowding. School-age children often introduce respiratory viral agents into households, resulting in secondary infections in their parents and siblings. Risk factors for pneumonia in children. Congenital heart disease, bronchopulmonary dysplasia, cystic fibrosis, asthma, sickle cell disease. Neuromuscular disorders, especially those associated with a depressed consciousness. Some gastrointestinal disorders, for example gastroesophageal reflux, tracheoesophageal fistula. Congenital and acquired immunodeficiency disorders. Cigarette smoke compromises natural pulmonary defense mechanisms by disrupting both mucociliary function and macrophage activity. Signs and symptoms of pneumonia in children. 1. Oxygen saturation of less than 90%. 2. Cyanosis, which is blue discoloration of skin. 3. Inability to feed. 4. Of P less than A. This means baby not alert, as a measure of level of consciousness. 5. Grunting, which is a sound produced by the baby by trying to keep the lungs open. 6. Lower chest wall indrawing. 7. Increased breathing. Treatment of pneumonia in children. Non-severe pneumonia: the child is given oral amoxicillin then reviewed after 48 hours in case they progress to severe pneumonia. Severe pneumonia: the child is admitted, put on oxygen, injectable penicillin and gentamicin. Prevention of pneumonia in children. 1. Provide safe environment with low risk of transmission. 2. Exclusive breastfeeding for babies less than 6 months. 3. Provide adequate nutrition and vaccination. 4. Practice hand washing and avoid indoor air pollution. 5. Cotrimoxazole prophylaxis in HIV-infected children. Complications of pneumonia in children. Pleural effusion, empyema, atelectasis, lung abscess, necrotizing pneumonia, peripneumonic effusion, pneumothorax, pneumatococcus,